And welcome back. It's Medical Monday with our hospital experts at East Cooper Medical Center. And women who want to preserve their fertility have so many options these days, one of those being egg cryopreservation. And Dr. Stephanie Singleton is a reproductive endocrinologist.
Endocrinologist.
There we go. They had the R in the wrong place. Infertility specialist with East Cooper. Thank you for joining us this morning.
Thank you for having me.
First of all, what is egg cryopreservation?
Right. It gives us the ability as women to freeze our eggs so that if we're not yet ready to have a baby right now, we can preserve that ability for later on.
Okay, and so that means that pretty much comes into when you're planning to have children. Maybe it's someone who has a career, they want to do that first.
Exactly. Those are the women, you know, this is really perfect for those women that want to delay that opportunity, but maintain that opportunity. It gives us the ability to make the decision as to when this is going to happen. Because all too often women pursue other things, their careers, you know, a graduate degree, and then by the time they do find that right person and are ready to settle down, maybe they're older, it's going to be much more difficult for them to get pregnant.
All right, so let's talk about who would be a good candidate for this procedure.
Any woman of reproductive age, but it's most beneficial to those women who are younger.
Okay.
So when we are younger, we have many more good quality eggs that we can take advantage of. So we're trying to encourage women when they are younger to make this decision so that they have better chances of having good eggs when they get ready to use them later on.
Okay.
So women who are less than 35 would be optimal candidates, although we do have women that are greater than age 35 who are still able to freeze their eggs and be very successful at it.
You know, I'm wondering about that because if they're past that optimal age for that, you can still get the eggs. And what if someone didn't want to have a child until they were in their 40s? Would they be able to with that?
As long as the eggs are frozen, then they can be maintained until they are in their 40s.
Wow.
And at the Fertility Center of Charleston, we will actually transfer those eggs up until age 49.
Oh,
so even at age 49, it gives you fantastic chances of getting pregnant with a healthy pregnancy because those eggs were frozen when you were younger.
Oh my. Okay. Now let's talk about perhaps someone who's about to start cancer treatments. What about someone who has, you know, cancer, but they're in remission, they're going through chemotherapy?
Right.
How does that work with if they wanted to?
Those are also excellent candidates. So when they receive that diagnosis, we would need to start treatment to be able to harvest those eggs before they undergo their chemotherapy, their radiation.
Okay.
You know, the difficult thing with that is that these women are faced with this diagnosis very quickly and they're having to make very fast decisions. So we try to get them in very rapidly to discuss this and try to encourage them to think to the future. You know, we're very good at treating many forms of cancer now.
Right.
And so, you know, they can maintain that ability to have children in their future.
Right.
Chemotherapy and radiation can be very damaging to eggs.
Okay. Now let's talk about what it all involves. You mentioned harvesting eggs. How do you do that?
Right. So the way that this works is that normally, naturally, a woman produces one egg in any given cycle. And with this process, we give them medications to enhance that egg production so that they are producing more eggs in a given cycle. They would take medications for approximately 11 days, during which time they would undergo some blood work and ultrasounds. And then they would undergo an egg harvest, which is essentially a conscious sedation procedure that is done in the operative suite in our office. So they're asleep. It takes about 15 minutes.
Not very long.
And then not very long at all. And then those eggs are frozen and preserved. There is no expiration date.
Okay.
So it does give them the ability to go through a fairly minimal procedure, but to maintain the right to.
All right, so we have about 30
Deliver
seconds. Do they need a partner? And what are some of the success rates? What are the success rates with this?
Success rates depend upon the patient and what they present with. They can be as high as 65 to 70%. And the average pregnancy rate is about 20% in a natural cycle. So pregnancy rates can be excellent depending upon the patient. They do not require sperm, and this is one of the benefits of this process is that you do not have to yet have a chosen partner.
Okay.
You can freeze your eggs and choose a partner later.
Okay, well there's the options for you if you're thinking about doing that and really have a planned pregnancy. How would they go about getting in touch with you? The information, of course, there on the screen.
Right, just contact our office at the Fertility Center of Charleston and we will work them in, be glad to see them.
All right, Dr. Singleton, thank you so much for joining us. Some great information there. More after the break, so stay right here.